You're watching a video about betrayal and you make the mistake of scrolling into the comments, hundreds of them. And under every story that sounds like yours, the same one-word verdict keeps appearing. Narcissist. Run. And somewhere in you, a question starts up that will not turn off, like, is my spouse a narcissist or a sex addict or somehow both?
And here's the most honest answer we can give you right up front. At the moment that question is burning the hottest, you usually cannot tell. Not because you're missing something, but because active addiction produces real narcissistic traits, and the difference only shows up over time, mostly in what happens once recovery starts. So today we want to walk you through how a therapist actually reads this pattern and what each answer means for your future with your partner.
And I want to start by taking your pattern recognition seriously, because it has earned that. Like, you watched your partner look you in the face and deny what they were doing. Like, not once, but over months or years, they chose the lie again and again. They rewrote conversations you remember clearly, and you started to feel unstable for noticing what you were noticing. And most people know that pattern now as gaslighting. So when you finally put those behaviors into a search engine, the internet handed you back one word, narcissist. Of course you would land there. Like, your system clocked that something was off a long time before you had proof, and it was right then. It's picking up something real now.
Yeah, this is where we want to slow down with you, and not because anyone needs defending, but the label that you settle on will quietly steer everything that comes after it.
Yeah.
Whether you believe change is possible, what kind of help you look for, how you hear every apology. And there's a wrinkle in how all of our minds work. Like, once a label feels right, confirmation bias goes to work, right? So every memory starts reorganizing itself around the diagnosis. The forgotten birthday, the way they dominated that dinner party, it all becomes evidence, and nothing gets to be ordinary human selfishness anymore. And that's not a flaw in you. That's just how brains work once they have a frame, once they have a label. But it's exactly why armchair diagnoses, even plausible ones, tend to miss the thing that matters most here.
Which is what exactly?
Well, sex addiction and narcissistic personality disorder can look nearly identical from inside a betrayed relationship. That's the thing that we want to unpack and tease apart here. And they're not the same thing. They're not the same condition. You can have one without the other. But what we see regularly in our practice is a lot of times betrayed partners are coming in with the narcissistic label already fixed in place, and sometimes they're right. And sometimes the label is actually, though, just describing addiction symptoms. And there are narcissistic traits, but not an actual personality disorder. And the difference changes what the future can hold.
Yeah.
Yes.
Yeah.
So picture two identical cars parked side by side. Same body, same paint, same speed on the highway. One runs on gasoline, one runs on diesel. And from the sidewalk, maybe say you cannot really tell them apart unless you're a real car expert. But the only way you learn the difference is by finding out what each one runs on. And chronic deception actually works the same way. So the lying, the double life, the defensiveness that you live through, all of that can be driven by two very different engines. That's what we're saying.
Okay, so let's open the hood then on the first one.
Okay. So the first engine here is addiction. In addiction, the acting out functions like a pacifier. It's a comfort mechanism, something the person came to depend on to medicate loneliness or stress or shame or some pain that they never learned to soothe in healthier ways. And around that engine, a whole structure of concealment gets built because the addiction can't survive exposure, and at a deeper level, the person believes they can't survive exposure either. Clinicians call this schema-driven deception. It's lying that works as a shame regulation strategy rather than a power strategy. And somewhere along the way, usually early in life, their nervous system learned that being fully known leads to rejection. So in the moment that your direct question to them hits, their brain is choosing regulation over truth, right? It's quieting an internal alarm that feels like annihilation, faster sometimes than even their values can get a vote in this. And that's why someone who genuinely holds honesty as a value can lie to your face and hate themselves while they're doing it.
I can imagine that someone hearing that, like, almost feels the ground shift under their anger. Naming the engine does not excuse the concealment. The acting out may have had a compulsive engine, The line that protected it was a series of choices made over and over. And your partner decided each time what you would be allowed to know about your own life. And both of those things are true. And real recovery has to face both.
It does, for sure.
Yeah.
A 2019 review in a journal called Frontiers in Psychiatry looked at how narcissism and addiction intertwine and found that the link runs through what researchers call affect regulation. In plain language, addictive behaviors often work to stabilize a fragile sense of self-worth. So the same underlying job, like managing unbearable internal states, can drive both the addiction and narcissistic-looking behavior that comes around it, which is exactly why these two patterns are so hard to tell apart from the outside, especially the pattern of, is this narcissistic personality disorder or is this narcissism protecting an addiction?
Okay, so that was the first engine. So can we lift the hood on the second?
So the second engine is different at its core. In narcissistic personality disorder, the deception isn't mainly regulating shame in a moment of panic. It's maintaining a position, control of the relationship, dominance of the narrative, or a grandiose self-image that has to be protected at any cost. Clinicians call this cluster antagonism, manipulation, entitlement, arrogance, a readiness to use people. And the part of this that is hard to hear is that the empathy that you sometimes saw was often performative rather than absent. Present when there was an audience or an advantage, gone the moment that it cost them something. So it's just used like a self-serving tool. And people who work with narcissistic abuse describe like a recognizable rhythm to these relationships. There's idealization, and then there's the devaluing of the partner, and then discarding, then hoovering you back in. And in this pattern, the lies aren't guarding a secret coping mechanism. They're instruments. They're just part of a personality system, if I could put it that way.
Yep.
Sex addiction and narcissistic personality disorder can co-occur in the same person, and the overlap is not an accident. A 2025 study in the Archives of Sexual Behavior found childhood trauma and sexual narcissism were strongly associated with hypersexual behavior. Both patterns often grow from the same soil. But here's what I tell clients. You can see real narcissistic traits in your partner: entitlement, grandiosity, lying, empathy failure, and still not be married to a narcissist. In active addiction, those traits are part of the symptom picture. So the question is never whether the traits are there. The question is what happens to them when recovery starts. Do they stay? Do they go?
Right. Yeah. And if you're the partner hearing this, I want to name what it might be doing to you. Like, you've been holding two pictures of the same person, and everyone around you keeps demanding you pick one. And the comment section, right, wants a verdict tonight. Your nervous system wants a verdict tonight because a verdict feels safer than not knowing. And what we're telling you is that the honest answer is slower than that. That's hard. And it's also the truth.
Yeah, that it might be too early to tell.
It might be too early to tell. Yeah. And sitting with that is hard.
Yeah, especially if you're at the start of your recovery journey. Your partners, they are. So let's talk about what a therapist actually watches for, because there are markers here. But first, like Arlene kind of stated plainly, so as counselors practicing in Canada, neither of us is qualified to diagnose narcissistic personality disorder. That's reserved for different kinds of professionals here. Belongs to a registered psychologist or a psychiatrist, that kind of thing. What therapists in our position can do is consider the diagnostic criteria, watch the pattern over time, and wonder about it carefully alongside you. Most in our profession avoid labeling while doing so. The DSM-5, the manual clinicians work from, frames narcissistic personality or disorder, or NPD, as a pervasive pattern of grandiosity, the need for admiration, and impaired empathy, starting by early adulthood and showing up across contexts.
Yeah.
So hold on to those words, pervasive and across context, because they carry more weight than what they sometimes get on the internet and in discussion forums, certainly. There's 5 questions that we sit with, and these are patterns a qualified professional assesses over time. They're not boxes to check here tonight.
Yeah. Okay, question 1.
So question 1, where does the distress live? When deception is addiction-driven, there's usually real internal conflict about the lying itself. Underneath the defensiveness, the person is ashamed, not just of what they did, the person who's acting out, not just of what they did, but of who they've become. And genuine remorse is reachable, not remorse for getting caught, but remorse for who they become. And that remorse, like I said, it's reachable, even if it does take some work, okay? Sometimes it can be hard to get there, especially if they're pre-contemplative with regards to change. But in a more characterological pattern like you would see with NPD, the distress tends to center on consequences. So sorrow shows up when the lie gets caught. And it can look like crocodile tears sometimes because its target is damage control rather than an empathic, genuine response to your pain. Now, one moment of either doesn't prove anything, right? The professionals who evaluate this, they look for patterns over time. Okay? Question 2, what happens to empathy when it costs something? So empathy isn't just one capacity. There's cognitive empathy, which is understanding what you feel. There's affective empathy, which is now I'm actually feeling it with you. And then there's empathic action, doing something about it. In narcissistic presentations, the cognitive kind is often intact and even sharp. And that's what makes the manipulation precise. But what's missing is kind of the load-bearing part of this, the empathy that holds up when your pain is inconvenient. In addiction, the picture's different. The empathy is often buried rather than absent because shame and empathy compete for the same bandwidth, right?
Yeah.
So it's hard for that to be there. And a person drowning in shame has almost nothing left over to feel your pain with you. Doesn't make it easier, but it's a nuance that we have to note. And yet in recovery, as the shame gets treated, the empathy tends to resurface. So watching which of those trajectories unfolds tells you far more than any single empathic failure.
Yeah.
So that's something to note as well. That make sense?
Yeah.
So far?
Yep.
So here's one of the most useful questions a therapist sits with when a betrayed partner asks whether their spouse is a narcissist or an addict with narcissistic traits. The question is, how wide does the pattern run? Addiction-driven entitlement and deception cluster around the addiction's orbit. The hidden accounts, the covered tracks, the defensiveness when you get near the secret. Step outside that orbit and you often find someone who's generous with coworkers, patient with the kids, kind to the server at the restaurant. A characterological pattern, though, would never respect those boundaries. It would show up in all those places. The grandiosity, the exploitation, they'll show up at work, with family, with strangers, and the trail will also run back to early adulthood, long before the addiction ever started. And that's a distinction.
Sometimes, is it possible for a narcissist to, I'm just thinking of grandiosity, like you said, being kind to a server at a restaurant. Sometimes they can.
Yeah.
But there's something about like for their own purposes.
Yes.
And then when that doesn't happen,
then the other side
shows up.
Yeah.
But it's hard because sometimes it looks like they're doing the right thing.
Yes. Yeah.
Like
often
it's complex.
Yes. Yeah, we don't really get too much into it, but often like in first impressions are strong.
Yeah. Yeah.
Very narcissistic people, yeah.
So wait, was that question 3? So are we on 4?
The fourth question, yeah.
Okay.
Yeah, good tracking. The fourth question is, what does accountability produce from this? So in sex addiction treatment circles, the narcissistic addict is sometimes called like the compelling patient, charming and articulate, psychologically minded even sometimes, and always like somehow like the real victim of the story. That's a sign. And accountability is where the two engines then begin to separate, these two different kinds of cases. In addiction-driven cases where that's the primary thing and there's just narcissistic traits, the accountability will land. Slowly and imperfectly, okay? But it lands. And grievances gradually give way to grief, and the person starts to own what they built, what they created, what they did. And yet in the narcissistic pattern, accountability reads as an attack. It triggers the victim card and a fresh inventory of your failures and a renegotiated story where their behavior was a reasonable response to being wronged. One produces movement over months, but the other produces rotation. It just keeps things spinning. The same conversation, endlessly kind of relitigated. That's another sign as well. And so if you've been living inside this question, we're curious about something specific. Like, did you notice anything without accountability? When you brought real accountability to your partner, what came back? Ownership that grew over time, or a story where you somehow turned out to be the problem? And if you're the one in recovery watching this, we'd honestly like to hear the other side too. Like, what did accountability feel like from the inside? These are two different vantage points that seeing them side by side in the comments will be worth almost more than anything we could say up here. So we look forward to hearing from you.
Yeah. That leaves
the fifth
question number 5.
Question 5 is like, what rhythm does the relationship follow? Because addiction has a cycle. There's build up, there's acting out, there's shame, a resolve to stop, and then around again. And as painful as that is, its target is the addiction itself. In that scenario, you were collateral to a war that your partner was losing privately. The narcissistic relationship cycle, however, is aimed at you. And so there's idealization that felt like destiny. There's devaluation that arrived, was placed on you without cause that you never deserved. There was discard or the threat of being discarded held over your head. And then that hoovering that pulls you back in just as you kind of found your footing and started to think you could do this on your own. In that push and pull, that warmth alternating with harm is also the raw material of a trauma bond, which is one more reason this isn't a differential to run alone just with like a search bar trying to figure it out. It's hard to unpack this stuff. Yeah.
And if you just heard all 5 questions and thought, honestly, like it could still be either one, you heard them correctly. Like that's the truthful position at the beginning, which is exactly why the real test is the one we haven't talked about yet.
Sure. But here's the clinical reframe that this whole conversation has been walking toward. This question usually can't be answered on Discovery Day. And that's not a dodge. It's how the two conditions actually get distinguished. Time under recovery conditions. That's the diagnostic instrument here. When someone without a narcissistic personality disorder enters genuine recovery from a sex or porn addiction, and I mean real treatment and therapy or group work and honest disclosure, not just white knuckle abstinence, when they enter that recovery process, the narcissistic traits fade, they recede. We see this happen. The entitlement softens into accountability. The empathy that shame had buried starts coming back online, clumsy often at first, but then reliably. But when narcissistic personality disorder is real, sobriety may still come, and it matters when it does. But the traits, though, those persist. The need for admiration, the thin performative empathy, that stays visible long after the acting out stops because they were never symptoms of the addiction. They were just part of the underlying architecture. And there is research behind this as well. A series of studies in the Personality and Social Psychology Bulletin found narcissism can have a state-like component. So when people were guided toward empathy and communal focus, like on one another, narcissistic responses decreased in the moment. Now that finding doesn't diagnose or rule out anything for any one person, but what it helps explain is why active addiction can amplify narcissistic-looking behavior and why recovery puts someone in a different context where you can finally see what remains. There's even an older study in a journal called Alcoholism Treatment Quarterly that found recovering alcoholics who scored high on narcissistic authority and superiority were the most resistant to the surrender that 12-step recovery asks of a person, which fits what we see. The personality pattern shapes how recovery itself goes.
So what do you actually tell like someone sitting in your office with this question?
Yeah, so 2 things, okay? One is don't pursue a diagnosis until recovery is well established because assessing personality in the middle of active addiction is unreliable. Right?
Yeah.
The addiction is actively mimicking the thing that you're trying to assess. And when the time comes, then take the question to a psychologist or whatever professional in your region is qualified to assess that, who's qualified to assess personality disorders rather than just, internet or informal verdicts on this, right?
Yeah.
Including ours even. So rushing to a label often misses the complexities of an addiction. Finding out what's actually true takes time here. But what the future of your relationship can realistically look like depends heavily on which answer comes back from that.
Yeah.
Yeah.
Yeah. Yeah. And to the person in recovery who's watching this, like with their stomach in knots, wondering which one they are, notice that you're wondering. In our experience, the person losing sleep over whether they might be a narcissist is very often the person whose empathy is coming back online. And that fear deserves a therapist's care, like not a comment section's verdict. The trails you're afraid of can fade as your recovery deepens.
The traits.
Traits. Yes. What trails? Okay, the traits.
It's kind of trails. Trails in your brain.
Yeah, I guess so. Yeah. Yeah. But watching them fade, watching those traits fade is something you and your therapist get to do together. I know some of you are already deep in that work, in recovery or in therapy or both. And we see you like this is the exact territory where that work pays off.
Yeah.
So let's talk for a minute about what each answer actually means, because this differential, I can't even talk today. This differential was never about sorting partners into like savable and disposable.
Yeah.
It's about managing your expectations honestly, so you're not paying for one future while living in another. If the pattern is addiction without MPD, the realistic picture includes genuine repair. With real treatment, honesty can be rebuilt. Mm-hmm. Empathy grows back. And many couples eventually build something more truthful than they had before the discovery. Like it's long work, usually years, and it's real.
Yes. Yeah. And if both are present, there's a genuine personality disorder, narcissistic, and addiction. Recovery is still possible, could be slower. The treatment has to address both the addiction and the personality pattern. Expectations need to stretch with this accordingly. And if NPD is confirmed by someone qualified to confirm it, we're not going to tell you your partner is impossible to love or beyond growth. People with NPD are people, and change is possible, although in our experience, this population is highly resistant to change. Mm-hmm. What can change is your calibration. Deep accountability towards a partner tends to be one of the hardest capacities for someone with NPD to build. So repair depends far less on how hard you try and far more on sustained internal work that you cannot do for them. And managing your expectations there is a kindness to yourself because it lets you stop auditioning for a repair that has to come from their side of the relationship.
Yeah. And here's something every betrayed partner deserves to hear, whatever the diagnosis turns out to be. Research with betrayed partners from Kevin Skinner's work that Caleb studied in his sex addiction training found the deception itself was one of the strongest drivers of trauma severity, more than the acting out. And a partner looking you straight in the face and denying what they were doing leaves a particularly deep wound. The lie itself is the greater trauma. So the hypervigilance, the intrusive images, the struggle to trust your own perception, that's betrayal trauma doing what betrayal trauma does. Your pain doesn't need a diagnosis of your partner to be legitimate. Which is why your healing is its own project on its own timeline. It doesn't wait for their recovery or their assessment or their permission. If what's happening in your relationship includes intimidation or coercive control or violence, then this whole differential question is not the priority. Like your safety is. Yeah. So everything we've said today is for relationships where violence is not the issue. In a violent relationship, we endorse self-protection. Full stop.
Stop, yeah.
Yeah.
Yeah. So yeah, this has been a heavy one, I think.
Yeah.
Yeah.
It's super common though.
Yes, super common.
I don't know if I've ever had a wife not think that their husband was a narcissist.
Yeah, there's the traits.
Addiction, no addiction, like.
Yeah.
Which is interesting because I don't hear the husbands coming in and saying, I think my wife's a narcissist. They have all sorts of other names, but. Very rarely. Yeah, just interesting.
We'll have to reflect on that later.
Yeah.
Yeah. So for those of you that are listening, before we wrap up, how are you doing? If you recognize your own relationship here in places, I'm glad you found us and spent this time with us. If you would like help with what you're seeing, with what you're hearing, this is the kind of territory that our therapists at Therapivo navigate regularly. We do general couples counseling and conflict counseling, but we also do the specialized work of betrayal trauma and narcissistic abuse recovery, including helping you read the pattern that you're living in with someone. Sessions are via Zoom, so location usually isn't a barrier, and the easiest first step is a free 20-minute consultation just to see if it's the right fit. If you're on YouTube, the link is in the pinned comment below. If you're listening to our podcast, head to our website, therapivo.com. Here's a shift that I would kind of love you to walk away with today. Like, the question that pulled you in was like, which one is my partner, my spouse? But perhaps the most useful question, the one a therapist can actually help you answer too, is like, what does the pattern show over time? Two different engines can drive the same betrayal experience. Addiction-driven narcissistic traits tend to recede as genuine recovery takes hold. The traits of narcissistic personality disorder persist after the acting out stops. And you don't have to force the verdict on this tonight. You're not even crazy for asking the question. Of course you would asking it. We would ask it, but asking it means your pattern recognition has survived everything that was done to it, which is resilient. It's great.
And whichever answer time reveals, it doesn't change what you deserve while you wait. Like, honesty you can verify, safety you can feel, and support that treats your trauma as real. So that's actually part of what we mean when we say we want to normalize therapy. This question is too heavy to adjudicate alone in a comment section. It deserves a room where someone qualified can hold it with you. So thanks for being here with us today, and keep normalizing therapy.